said it's about to start, so let's see how this goes. Gonna try this again. Okay, it seems like it's working. Let's see. Am I able to share my screen? Let's see if I could share my screen. Hi, everybody. Hopefully I'm doing this correctly. Not sure, you know, this is like my second time actually trying to stream this thing to Facebook Live. Hopefully this is working this time. I tried once before, but it did not. It did not work. I'm really hoping this is working now. I'm gonna jump off this PowerPoint and go on to Facebook just to see if I'm able to see the live stream. Bear with me. Let's see, Facebook. All right. Okay, so it is working. All right, awesome, it is working. All right, so for everybody who don't know me, my name is Pam Manning, and I'm a nurse practitioner. I'm the owner of Nclex Mentor and Coach. Actually, I'm hearing this echo and it's a delay, so let's try something else. All right. Let's go on Facebook again. I'm gonna pause it on Facebook. How do I pause it? Not sure. Okay, that did not work. Let's see. Hi, Joyce. Girl, I'm trying to learn how to share this thing to Facebook, stream it live. This is such a task. I think I need a training on this. Let's see if I can move through. Actually, I can't do it this way. There got to be another way. I know somebody out there is going to teach me how to do this. I have DVT for you, Joyce. You're going to like it. It's really short. I just need to stop hearing this echo in my ears, and I don't know how to do it yet. So I'm trying to jump back and forth. All right, let me take off this headphone and try to use my computer without the headphone. So let's see. All right, Joyce. All right, let me take off this headphone and try to use my computer without the headphone. Can you still hear me? All right, Joyce. All right, let me take off this headphone and try to use my computer without the headphone. Can you still hear me? All right. Joyce, give me a thumbs up if you can hear me. And try to use my computer without the headphone. Can you still hear me? All right. Joyce, give me a thumbs up if you can hear me. There's a delay. No, I like it better with headphones. This is too loud for me. Okay. I'm just have to figure out how to do it. And someday somebody will feel sorry for me and help me. Come on, computer. Bear with me. Trying to do this Facebook Live is just totally messing me up right now. Gotta jump back to Zoom. All right. I keep doing that. All right. I'm gonna try to do it this way. I won't be able to see your comment. I'm trying to get my screen to move. I cannot seems to. I can't seems to get it where I could see your comment. Let's see if I could drag it. Okay, I think I'm able to drag. Oh, let's try this. All right, guys, sorry about that. I'm ready to start. This is going to be a really quick PowerPoint on DVT. And what I'm talking about is something that hit home for me. My name is Pamela Manning. I'm the owner of my online classroom, Nclex mentor and coach. I also do private session tutoring. We are at 100% pass rate. We specialize in those who have failed their LPN and RN Nclex. And we have a really good strategy that work. You will have to read. Don't think you can come and expect for me to be teaching you the content. That's not what I do. However, when I'm tutoring you, if there's some areas you're weak in, I will help in that area. But what I do is totally different from what others do. I break down questions with you and I show you how to do select all and apply and how to understand what the question is asking you. And I also teach you how to do, how to understand Maslow. And my students love me. People are doing different reviews about me now. I never used to ask for it, so you never used to see it, but now you're able to see it. So today I decided to teach you a topic that I really believe you need to know about because it's very important, and some people may not know how common it is, but it's deep veins thrombosis, which is otherwise known as DVT. According to the Merck manual, lower extremity DVT most often results from impaired venous return, which is like on your patient that's immobile, and endothelial injury. So like, for instance, if you have trauma to your leg, then you're at risk. And the patient also need to be having a clotting issue, like hypercoagulate to state. This is a diagram that I got from Google image, and this diagram tells you how common the condition is, and that's the reason why anything that's common usually come on state board. Guys, anytime you're reading it, you know it's a condition like hypertension, diabetes, those are popular, those are common. So anytime you see something that's common, you need to know it going into your state board. In regards to DVT, each year, there's at least 300,000 people that affected by DVT, and it goes up to 600,000. Now, I was one of those people that it affected in 2010. There was nothing wrong with me. I just needed to have a simple surgery. But the fact that I had surgery, I end up become a risk factor that surgery become a risk factor for me to have DVT. However, because at that time I was in my 30s, I was overlooked. So I had it really bad. My entire left legs were blocked. And then I end up getting a greenfield filter and also 2 stents in me. So this is a very common condition. And a lot of those people who got diagnosed with DVT die each year. And it's people like flight attendants, people who are traveling in a long distance, they're at increased risk for having DVT. Even truck drivers are at risk for DVT. People who smoke a lot, and you know that's a lot of people in America that smoke, they are at increased risk for DVT. Guys, while you're watching, I can't see your post, but if you're there, thank you for joining us. I'm just covering DVT right now for you. Give me some arts, thumbs up, share. Well, it's a private group, so you won't be able to share, but invite your friends to the group who you know need help. Just give a comment. If you could hear me, I can't see you right now, so I'm really hoping that you can hear and understand what I'm saying clearly. My phone is echoing, so sometimes it may sound like it's, you know, like I'm fumbling, but it's because I'm hearing myself in my headphone. So I'm sorry, I'm trying to get used to that. So people who smokes are at increased risk. If you're sitting around, older folks sitting around, not able to get up and go, you're at increased risk. If you take birth control pills, something that's very common, you're at increased risk, or hormone replacement therapy, you're at increased risk. If you go for a surgery, just the fact that you're laying down, you're at increased risk. If you're overweight, you're at increased risk, right? If you had a previous DVT, like in my state, I'm at increased risk for DVT. Just to be pregnant, you're at increased risk. Or if you're over 40, and especially those over 60, is either at extreme risk for DVT. This is another table that I really needed to focus on and let you know. Usually for a person to have DVT, they have to have these 3 things, factors. Hypercoagulability. Major surgery or trauma can cause that. Pregnancy can cause that. If a person is dehydrated, of course, the blood gonna be thick. So they're in a state that is easy for clot to occur. If you're on estrogen therapy, it can also occur. Vascular damage, right? That's important. Vascular damage. If you get in trauma, if you fracture somewhere, hurt your leg, beat up, somebody punch you, beat you up really hard, that right there is trauma to the vessel. Cellulitis can cause trauma to the vessel. So yes, you can be at increased risk, including strain. Circulatory stasis, what that is, stasis, moving, lack of moving. Immobility, that's a high risk for DVT. Low heart rate, so if your blood is not pumping too good, of course, it's gonna put you at risk for DVT, and you could read some of the other stuff on the screen. This is something that if all 3 is in place, you are extreme high risk for DVT, guys. And this is a condition you need to know going into the boards. Diagnostic, what is it? What test the doctor gonna order? What are you gonna do? Assessment is the key. If a person is at risk for DVT, you want to listen to their lungs, because with DVT comes PE if that clot that usually found in the extremity travels, right? So once it's moving, it's called an emboli. So pulmonary emboli is possible. So therefore, you want to listen to lung sounds. You want to make sure these people not having short of breath. These are some of the things you want to assess for. Good assessment is the key. You also want to do Homans. Remember when you flex that person's legs? That's called dorsiflexion. When you bend the legs and fold the knee and ask them if they have pain in the calf area, that's because you're checking for DVT. The doctor may order a lower extremity Doppler. Doppler is an ultrasound. It shows the blood flow. When you have a clot, therefore, when it changed color, you could see it's that they have a clot in the vessel. They can also order CT scan, PTINR, PTT, and D-dimer. There's different things you can do with suspect of DVT. As nurse, you want to look at the skin. You want to assess swelling, redness, warmth, right? Look at the picture right there. This is important finding. You need to check if the patient complains of any pain. By the way, sometimes there's no symptoms. Sometimes there's no symptom, but in my case, I'm a nurse, I know what to spot. I had no swelling, no redness, none of those things. All I had was some pain in my lower back, not my leg, but my lower back. I went to the doctor didn't catch it. Days later, I was in the hospital for 10 days, almost died. God was watching over me. Thank you. All right, so how do you treat DVT? You treat it with heparin. You could do low molecular weight heparin, which you need to know. That was one of my questions, I believe. I can't give you exact, but and that's years ago. But low molecular weight heparin, that's simply talking about Lovenox. You need to know how to give it. And that's done in the umbilicus, in the abdominal area. They call it the love handle, the fatty part of your stomach, away from the umbilicus. So you need to know the inches away from the umbilicus that you give in those shots, and you need to rotate those areas. You can't keep doing it in the same side, okay? So you need to read up on that skills because they may ask you how you give it. Also, you need to know about Coumadin. You need to know about that the patient can have a filter, which is what I mentioned that I had to have. So these are some of the treatment measures. For nurses, what you need to do, you want to mainly think safety. So when you're dealing with a DVT type question, you want to think about safety because the patient could get a PE, or the patient may be on blood thinner, so they could be bleeding out. So you're going to watch for bleeding. If their blood is too thin from being on the blood thinner, you need to know the antidotes for both heparin and also Coumadin, which is same as warfarin. That's vitamin K for Coumadin, and it's protamine sulfate for heparin. Guys, you really need to know about these drugs because these are things that a lot of patients in America is on Coumadin and or heparin. And if they are on it, you need to know the antidote. You also need to know the lab that you draw when they're on both Coumadin and when they are also on heparin. You need to know the difference. One is PTINR, which is done through Coumadin, and the PTT, the double T, is done for heparin. I need you guys to know these things going into the Nclex. To be successful, these are things that's very important because it's a common condition. As I said to you, it's not just old people get it. You have younger folks get it too, like myself, I had it in my 30s. Truck drivers, long distance frequent flyers, they are at increased risk for DVT. Finally, I told you this was a really quick presentation. DVT is not one of those topics that takes forever. Just so you know, I do tutor. I tutor privately. You could find me on NP, like nurse practitioner, npexams.com. npexams.com. I do private tutoring. I'm at 100% pass rate. I work with students. I break down questions with students. I teach you how to critical think. I specialize in those who have failed. So you don't have to fail to elect to use my service, but I'm just letting you know, I've worked with people who failed 9 times, 8 times, 7 times, 4 times, 2 times, 1 time, never fail. I've worked with multiple different type of nurses. I also teach EKG and different class. If you've been out of school for a long time and you need some refreshers on content, I do charge separately for those kind of tutoring. But I do have weekly session. You could pay for a package deal and get discounts. Check out my website, npexams.com. Anyway, nursing consideration. One of the things you want to focus on is early mobilization. You want to elevate the legs. If a person went to surgery, you want to have that person ambulate. Watch that doctor order. If they say day one ambulation, get your patient up day one. If they say give some Lovenox, get that Lovenox into that patient, because each year up to 600,000 people are affected by DVT. So you want to make sure you are doing your part to take care of your patient. SCDs, those synchronizing device that you put on their legs and it pump, that you want to make sure the patient have on when they're not actively getting up. Or TEDOs, you want to make sure you do that. That help with circulation in the blood. All right. Thank you guys for watching. I hope that you did. I hope that you did comment. I'm going to look to see if I see anything. And again, this is a delay. Thank you, thank you, thank you. Okay. All right. So I noticed that it said website again, please. I'll put it here. So guys, if you need to comment, ask me a question. I'm on Facebook right now. I'm no longer showing the PowerPoint. So guys, that website, even though you see nurse practitioner, is both website, because I also do nurse practitioner. I don't tutor nurse practitioners, but I have an online classroom where they can go and do different questions, like unlimited questions. But for this particular Nclex, I do work with you guys. You could watch those videos that of students that just recently either current in my classroom or recently passed their boards. So you can listen and watch. You don't have to take my word for it, but you could hear from them. You know, I spend time with you guys. I do my best to help you pass. Sometimes you guys have to invest in your future. I know some of you spend way too much money out there. Well, try something different. I do not do what others do. I truly seek out to help you. I'm not going to be taking your money if you're not following my plan. If you're trying to do my plan and you're not following through and do what I want, I'm not going to waste my time. I will warn you and talk to you and stuff, but then I'm going to get focused on other students who want to take it serious. Time is too short to sit there and trying to force you to do something. You have to want it for yourself. It's 2018. It's no way you should be paying $30,000, $40,000 to go to nursing school and not really doing stuff about it. Isabel, how are you, darling? I hope you got the, that was Michelle asking for the website. I just posted the website. But like I was saying, you know, nursing school was no joke. Some of those teachers drive you crazy. Teachers like me who tell you can't come in their class, in my classroom without your hair comb and your uniform pressed. Yeah, I was one of those teachers. And I still believe in that because it's a profession that you need to look like the part. But I am real. I don't play. I give a plan. I give you an online classroom. In fact, I'm gonna share you another page of my online classroom. Hold on, let me open up a website so that I could show you. Give me a second, okay? Where is it? Where is my classroom? Okay, give me a second, guys. I'm on another site. Why is it not coming up? Okay, I think I got it. Okay, I got it. I'm gonna share with you what you get when you pay. Okay, give me a second. I'm not looking at you guys anymore. I'm gonna share my screen. All right. I believe you guys should be able to see this. When you get in my classroom, you get quite a bit of information. I'm gonna go to, let me make sure that I'm in I have different classrooms. So let me go into the one that you guys would get. I'm gonna open up my syllabus. Now, let's go on to this. There's so much information here for you to do. I give you weekly assignments that you can do. I have so much quizzes because the key for you to be successful, especially if you have failed before, is the key is to stay consistent and to stress your brain to think that you are still in school. When you were in school, you had to show up. You had to study for your tests. You had quizzes or you have exams, several chapters to study. When you're out of school, nobody is pushing you anymore. So you study when you want to study, you do what you want to do. Nobody's there to say, get up, study for your test, those kind of things. So me, I push you. I give you a lot of assignment. There's tons of quizzes. I recommend the book that I post in my chat for you. I give you a plan to work on. You have a lot of things. I call. Well, you got to also call because I'm not going to baby anybody. If you want this, you're going to get up and call, but I make myself available. See all these quizzes? There's a whole lot of quizzes. You get all of this when you pay me weekly. I don't give it to the people who don't elect to pay me weekly. If you just want a one-time session with me, I'll give you that. But for my students who pay me weekly, I'm going to go above and beyond to help my students. So I'm going to give you my online classroom of all of this stuff for you to dig around. My screen sometimes it's, I guess I'm going too fast, but you can see a lot of stuff. Let's see what else I have here. Oh, I also have for visual learners, I have some information here, which is public stuff. You could get this anywhere. However, I have it in one location for you. So let's say you are studying and you can't remember something. Look at that. There's a lot of information on here on my website for you. Let me see how I can close this. I gotta close this, okay. All right, so my classroom, I do have a lot of students. I have a lot of students in my classroom. You could say it's a lot of students. I'm not gonna make you see the people that's in it, but you could see that there's a lot of students in my, and why is it going back to that? I didn't mean to. All right, so I'm gonna close out of this screen so that I could go back to Facebook. Okay, guys. All right, so I see Isabel. I know I spoke to Isabel before somehow. I saw you said you need my help. Isabel, if you need my help, any of you guys who need my help, I have a lot of student schedule, so I can't literally talk on the phone with so many people at a time. If you need my help, you got to go on the website. You have to select the plan you want. There's a drop down box of different plan. Once you pay, I'll get an email, but make sure you send me your full name through my website and your email, and just say you pay, and then I will put you in the classroom. Okay. I have to have you request your book. The book is posted on the website. There ain't no joke. You got to read. You got to read. I could tell. You may not be right in front of me, but I could tell. Any one of my students, they could tell you. I know if you're reading or not. And I stick on you, and you have to do the plan, or don't pay me. I'm telling you, don't pay me. I take this serious. I take it serious. I do believe that as students, you pay a lot of money and you should pass. But some of you guys, you give up. Because you fail, you give up. Failure don't mean give up. Failure is not to hurt you. Sometimes you guys just need to humble yourself, and God is making an example out of you. So it's probably for you to help somebody later. So hone it. Yeah, you failed, but you stop. You already cried. You just need to cry one day and get over it. Get over it. Get over that. It's a new year. Get rid of some of those books you're using. Get the new book. Start over. If you need to invest in me, I'm there to help you. However, if you're just trying to come on and say you're going to pay me this week, and then you're not following the plan, don't waste your money. Just get me for once, so I could do my best to help you. One time ain't going to help, but I could do my best to help you. If you just want a one-time thing, you could watch my video in the chat. You don't need to pay me if you're not going to follow the plan. Just watch my video. But when you watch my video, I'm going to go out of my way to make sure that you guys are successful. I don't just talk. I'm serious. If you need to elect to get my service, just go on my website. It's posted on the comment, npexams.com. It's both for nurse practitioner and for LP and RN, npexams.com. Guys, thank you. I thank you so much for joining me. Those of you that dropped by, thank you. I hope you were able to hear my live review of my DVT. If it helped you in any way, comment, invite your friends, tag your friends in there, okay? And have a blessed day. Before I go, is there any question? I'm just gonna sit here for a second and see if anybody have any question. It's a delay, so if you comment, just wait and see if any questions come in. And if after the broadcast, if you have any questions, you could comment below. Sometimes it takes a little while for me to see that comment. But if you want for me to see your comment quicker, you want a friend request me, Pam Manning, and I'll accept you, so that whenever you send me a comment, it will pop up on my phone. But when you send me a comment through the group, sometimes it takes a little while for me to see it, okay? I am in nursing school now in my 3rd semester. Could I use your service to get a head start, make sure that I have strong, solid foundation? Michelle, you trust me, you would be better off than I was when I was in nursing school. I truly believe having this service, what I'm doing, should have been given to students in fundamental of nursing. I'm actually currently writing a book on it, and I'm close to finishing, but this should have been given to students in fundamental. Yes, yes, yes. You would be better off if you had it in fundamental. So right now it's still okay. It's still okay. I hope that answered your question. Any more questions? All right. Yes, that's answer. Okay, so I know Michelle. Anybody else had any? Isabel say, I want to be a PN now. Let me make sure I didn't miss any questions. No G. I'm not sure if I pronounced your name. Thank you guys, Ramon. Thank you for joining. Joyce, thank you. Thank you guys. Not sure how many of you got on the live feed, but thank you so much. And thanks to tell me that I look good, because trust me, this thing here, I've been trying to get on this thing for so long. It took so long to get on. All right, guys, I gotta go. My kids are home from school. You have a blessed day. All right, so I guess I would stop sharing.